Ladies and gentlemen, thank you for standing by, and welcome to the COVID-19 media briefing. At this time, all participants are in listen-only mode. After the speaker's presentation, there will be a question-and-answer session. To ask a question during the session, you will need to press star 1 on your telephone. I would now like to hand the conference over to your speaker today, Michael Schomer. Thank you. Please go ahead.
Thank you for joining us for the COVID-19 media call for October 9th. We'll start today's call with a situation report from Health Commissioner Jan Malcolm and MDH Infectious Disease Director Kris Ehresmann. We also have Minnesota Department of Education Deputy Commissioner Heather Mueller on the line to provide an update. After those opening comments, we will open it up for questions from reporters on the line. With that, I'll now turn it over to Commissioner Malcolm.
Thank you, Mike. Good afternoon, everyone. Globally, around the world, we were above 36.5 million cases and 1 million deaths, over 1 million deaths. In the United States, as of this morning, we're now over 7.6 million cases and 212,000 deaths. As we've talked about, these numbers are getting a little bit rote sometimes feeling, which is why I think it was so helpful to hear the stories of Minnesotans the other day in the roundtable that Governor Walz hosted, to put these numbers into context. That each of these numbers represents a person, a family member, a loved one, a member of our community. In Minnesota yesterday, we had an additional 1,401 laboratory confirmed cases of COVID on a total testing volume of just under 32,000 tests processed yesterday. This brings us to a new total of 109,312 cases in Minnesota. The median age of the cases has jumped up again to 36.0 years old. It had been stable at 35 for some weeks, which I think is reflective of what we've been saying, that even though we had a significant number of shift age-wise, demographically, to younger people contracting the virus in recent weeks, we have expected and are now seeing that secondary and tertiary transmission into older and higher risk parts of the population. Very sadly, we had 14 additional deaths among Minnesotans reported yesterday, bringing our total now to 2,121 deaths in Minnesota. These Minnesotans ranged in age from their 50s to over 100 years old, and they came from 10 counties across the state. 13 of these deaths occurred in residents of long-term care facilities, underscoring, again, what we've been talking about for several weeks, the risk of the spread, especially with such high levels of community spread, how easy it is for the illness to be brought back into these facilities that have worked so hard to stabilize their outbreaks and to prevent infections from spreading. Again, back to sort of the relationship between the growth in testing and the growth in cases. Week over week, we've seen 8.3% more tests delivered in Minnesota, and the weekly change in cases, so the case growth during that same period of time in the past week, is 7.9%. The 7-day average testing positivity rate, which does have a 1-week lag factor to it, so this is as of September 29th, remains at 5.0%, which is thankfully down a little bit from 5.4% the week prior, but we've been at or above the caution threshold for testing positivity, which we consider to be 5%, for 13 days now. And given what we know is in that 1-week lag period, we don't believe it's going to be going below 5% anytime soon. Again, just important to note that with the very significant growth in testing that we've seen in the last month in particular, the fact that we've not managed to get testing positivity below that critical 5% threshold is of concern to us, that we would expect with this increase in testing that we might have seen a drop in the test positivity rate. With that, I'm going to turn it over to Kris Ehresmann for some comments.
Thank you, Commissioner. There's been a lot of attention focused on the alarming stories coming out of Wisconsin and some of our neighboring states about rapid increases in cases. We are not in quite the same situation here in Minnesota, but we're worried that we have multiple warning lights coming onto our dashboard and we need to take them seriously. Our concerns are statewide, but one thing that has changed in recent weeks is that the hottest of our hotspots are now outside the metro area. The top 12 counties with the highest per capita growth in cases are all outside of the Twin Cities metropolitan area. Martin and Pipestone counties are both over 10% positivity for the last week, and as a reminder, the threshold for elevated concern is at 5%. So just half of that rate. And we are seeing similar increases in the northern part of the state as well. We know that there was a perception early on in this pandemic that COVID-19 was only a problem of the big cities. Things were never that simple, but the latest data show how far off the mark that perception is now. We need people in greater Minnesota to understand that they have it within their control to make things better. It starts by following those 3 pillars of COVID prevention that White House advisor Dr. Birx mentioned when she visited here: masking, social distancing, and avoiding crowds. It's not one of these, it's all of them. And then just a quick update on hospitalization data. For those of you who didn't hear about this yesterday, on September 24th, MDH revised its hospitalization data on its COVID-19 situation update webpage. We replaced the daily report of the number of cases in the ICU and hospital to a daily report of the number of new admissions to the hospital and ICU. Yesterday, we added data on hospital capacity to the existing response capacity information on the state's response capacity dashboard. And there is a link on the Department of Health website that can take you to that. These changes provide the best picture of both the severity of COVID-19 for Minnesota residents and the capacity of our health system to respond to the virus. Understanding total hospital capacity is important because it gives us a broader understanding of hospital capacity regardless of flu, COVID, or other illness resulting in hospitalization. Thank you, and with that, I'll turn it over to Deputy Commissioner Heather Mueller.
Thank you very much. We know how important it is for families to be able to support their students while they are participating in activities, athletics, and school events. At the same time, we know that during the COVID-19 pandemic, we have been very careful when it comes to activities that bring people close together, especially indoors. Our Department of Health provides the highest-level public health guidance that is broadly applicable, and then it needs to be applied in many different contexts and settings. Other agencies, including MDE, work with our Department of Health to make the guidance specific and applicable within each of our domains. MDE has worked with the Department of Health during the planning for the school year to develop guidance on restricting non-essential visitors in the school setting. Most recently, we also partnered again to bring further definition around what it means in the context of out-of-school time events, games, concerts, plays, and activities that are hosted in school buildings. The Department of Education and schools have to balance the important benefits of in-person learning with the mental health and emotional health of our students and with the very real risk of COVID spread in the school environment. Yesterday, the state issued new guidance that's consistent with that balance and consistent with public health guidelines. This is a really tough time. It's such an important time in the lives of our kids and their defining moments for their lives as well as for their parents. And I understand this. I'm a mom of a senior and a sophomore who are involved in sports and activities, and I want to see my seniors play at sports and be involved in those activities, and I really want to ensure that we're protecting the safety and the wellness of his friends and their families and our community. And honestly, as this time goes so quickly, it's another heartbreaking part of the story of what this virus is doing in our communities and in our schools. It's why our epidemiologists in the Department of Health have worked hard with education leaders to figure out a way for kids to do what they love and for their parents and other loved ones to be able to be a part of it, and to do it while minimizing the risk of spread of the virus and its transmission. That's what this new guidance is about. It's not perfect, and it gives schools a complicated task, but they're up for that. Some of them were able to implement the new facility guidance as early as last night. I want to make sure that I end with a public thank you to our schools for everything that they are doing and for the Minnesota State High School League and their partnership. Everyone is working so hard to do what's best for our students, and we so appreciate you all. And with that, I will pass it back to Mike.
Thank you, Heather. Operator, we are ready to take questions.
Ladies and gentlemen, if you would like to ask a question, press star 1 on your telephone. We'll pause for just a moment to compile a Q&A roster. And for our first question, it's from Jeremy Olson from the Star Tribune. Jeremy, your line is open.
Hi, you've been talking for some time, and Commissioner, you alluded to this, that growth and infections among young adults and in the communities would eventually result in spread back into long-term care facilities, and maybe today's high death numbers is a reflection of that. But I was wondering if that's still a theoretical growth, or if you're actually seeing increases in cases, outbreaks, infections in long-term care facilities again.
Yes, this is Commissioner Malcolm, and I'd invite Kris to comment as well. But yes, we have been reporting and do report on our various web pages what's going on in long-term care in terms of the number of facilities who have active cases and the breakdown of how many have more than a certain number of cases. So the good news is that still the great majority of facilities do not have active outbreaks, but we are watching with concern as additional facilities each day report new cases, and as there are more cases or more facilities struggling with larger numbers of staff being infected and getting infected from the community spread that we talk so much about, and that produces a double problem. It's both when the staff are sick, they can't work in the long-term care facility, which creates some real staffing challenges, which facilities are working hard to deal with. But then also if the staff are infected but don't know it and are bringing the infection into the facility, it can reignite the spread within those facilities. So yes, we are seeing more facilities reporting cases and reemerging challenges with the number of cases per facility. But again, I want to just reinforce how much fundamental progress has been made with improving infection control and just improving the speed with which, through more rigorous testing and follow-up, that cases can be identified and spread contained. But counterbalance that with the desire that everyone has to allow families, essential caregivers, and families to see their loved ones, all the harms that we've talked about isolation for those living in congregate care facilities. And so as eager as we are to have people able to visit, and the importance of that from a health perspective, that's just made all the more challenging when we're starting to see infections growing again. Sorry for that long answer, but so Kris, again, if you have any specific data you want to chime in on, please feel free.
Yep. Thank you, Commissioner. Yeah, Jeremy, what we're seeing is that obviously in the spring we were seeing a large number of cases, and then, as you said, that tapered off. What we've been starting to see is that the number of new cases in long-term care has increased over the last weeks. And so while over the summer we were seeing a very low number of new cases and staff and residents, we added 77 new cases today. So we've gone from 20s to 30s to 50s to now we have days where we're adding over 100 cases a day, and today happens to be 77 new cases. I think what is significant and worth noting, and the Commissioner alluded to this, is that the majority of cases are in staff, and so their transmission setting seems to be outside of the work environment. So that really tells us that the transmission is occurring in the community setting and then coming into the long-term care facility. And the fact that we're having fewer cases in residents proportionately encourages us that some of the work that the facilities have done to really step up their infection control is making a difference. And I can certainly provide you with all the detailed numbers from today, and I can email that.
Yeah, I'd welcome that. And then just to follow up, I just wanted to check one thing you had said, Commissioner, regarding the positivity rate. I mean, it was early in the summer when the CDC had estimated that every one positive was 10 cases that had never been tested, but due to being mildly symptomatic or asymptomatic altogether. Since we're testing more, should we be surprised that the positivity rate is doing what it's doing? I mean, if there's all these people out there who had cases and just we didn't know it, shouldn't that testing rate just be holding steady even if we're doing more testing, or should we have really expected with more tests to see a decline in that rate?
It's a great question, Jeremy, and I don't have a specific formula for you about what would indicate where we should be surprised and where we shouldn't. Certainly the fact that we're testing, 60% more people this month than we were last month, it's not a surprise that we see daily case growth as we are. But the fact that that we're still finding, a consistent percentage of cases as we test more, rather than seeing a lower percentage, just means that there's the viral load that's out there, the amount of virus circulating is not decreasing. So I didn't mean to make an artificially precise statement there, but just I think the fact that test positivity is not falling indicates that the prevalence of the virus is not declining. And Kris, maybe you could be more articulate on that than me.
No, I think you did a good job. I think the bottom line is yes. Even though we're testing a lot more people, the fact that we are continuing to have a consistent high rate of positivity means that there's a lot of disease out there, just like the commissioner said.
Thank you.
And for our next question, it's from Catherine Richard from Minnesota Public Radio. Catherine, your line's open.
Hi. I was forwarded an email this afternoon from the Minnesota VA that described a pretty urgent situation when it comes to ICU capacity. This email states that there are only a dozen ICU beds in the Twin Cities right now, and that we might have to start moving people to Duluth and Rochester as a result. Can you confirm this? Is that accurate?
Well, we do track very carefully ICU availability all over the state on a real-time basis. So yes, it is the case that ICU capacity is tight, we've also mentioned, and it's still true, that the great majority of the hospital capacity in use is patients other than COVID patients. That's true for both general medical surgical beds and ICU beds. It is running very tight, but that is actually not that atypical for especially the summer season. There is a process in place where the hospitals are talking with each other and with us literally on a more than daily basis to make sure that if there is a need for, we refer to it as load leveling or transferring around, that is a very planful thing. So we're watching it closely, but at this point, I think the degree of hospital occupancy is still, very much kind of in the expected range.
Are you seeing any capacity issues regionally? Like it might be okay in Rochester where I am, but it's pretty tight in the cities. And also, why might we be seeing that? I wonder whether we're getting any overflow from the states around us as well that are having a lot of cases right now.
It's a great question, and yes, we are seeing some use of Minnesota healthcare resources by residents from our neighbors, particularly in the border communities. And yes, there are differences regionally, which is really the beauty of the statewide coordinated approach that the health systems and hospitals are taking to really proactively sharing information with each other so that we know where those pinch points might be coming. I don't know, Kris, if you have any specific data that you'd call out on this point or not.
No, I mean, we've certainly been asked about this, and if we're seeing, in particular locations. We know that our bordering states are currently overwhelmed with COVID, so it's not surprising that we would see transfers to Minnesota, but I had not heard about the Metro ICU question that you asked, and as the Commissioner said, the regional teams are working together to ensure that we have adequate capacity across the region.
Okay, but I just want to be clear, you're not seeing, when you talked about those red flashing lights earlier, Kris, is hospital capacity one of those that is of concern right now, or not? And I just want to be clear, are you seeing any regions of the state that are in particularly tight situations right now?
So when we talk about the red flashing lights, certainly our concern and what we want to acknowledge is that we're seeing the number of hospitalizations, the number of individuals hospitalized with COVID and in intensive care with COVID increasing. But I do want to mention that if you look at the page that the web page that shows hospital capacity, you'll see that COVID cases, while significant and an important thing for us to monitor, represent a small portion of total hospitalizations and total intensive care use.
Right.
So I think that's an important thing to keep in mind. We've certainly been asked about the northwestern part of the state, and we know that, their capacity was at 53% full overall. So we know that, different regions of the state definitely are at different capacities. And as you said, the metro region typically has the most activity. So as a comparison, they're at 95% and the central region is at 82%. So there's variation across the regions in the state.
Okay, thank you.
And for our next question, it's from Gordon Severson from Care 11 News. Gordon, your line's open.
Hi. Yeah, the president has said recently that he is eager to get back on the campaign trail, even saying he would like to possibly have an event in Florida as early as tomorrow. And with Minnesota being identified as an important state by both parties, is this a concern that MDH is worried about? And also, I'm just curious, what sort of role does MDH play in these sort of political campaigns and stops? And if MDH doesn't have jurisdiction, which agency kind of is in charge of that?
Maybe we could clarify your question in terms of our role. Certainly, as we mentioned before on calls, the governor has sent a letter to both of the presidential campaigns, just reminding them what our gathering size guidance is, for example, and asking for their help and support in modeling the right way to do these kinds of gatherings. We certainly understand the importance of the time we're in terms of the election and people's desire to hear from the candidates. We still, however, really strongly encourage the avoidance of large, closely packed together crowds, whether indoors or outdoors, without the social distancing is very, very key, as Kris has said again today. Masking helps, but distance is extremely key. So we hope that if the campaigns do come back to Minnesota, that they do so in a safe way. And in terms of agency jurisdiction, our responsibility is, if there are issues, to follow up on any transmissions that might occur.
And Commissioner, if I could add, I was just going to add that thus far from the Trump rally in Bemidji that people have been interested in, we have had 9 cases so far that have reported attending that rally. And this is for the Bemidji rally. 9 cases reported attending the rally. 1 case was known to be infectious. There were 2 hospitalizations that were associated with that. 1 who was in intensive care, and no deaths at this point. So that is from the earlier rally, and we're continuing to monitor for the rally in Duluth.
Thank you.
For the next question, we have Marielle Moos from WCCO. Marielle, your line's open.
Hi. So most of my questions have been answered, but while I have you, I just want to ask or clarify. Commissioner Malcolm, you said that hospital occupancy is still very much in that expected range. We're hearing Bemidji hospitals are starting to ask for transfers because their ICU is full. Are you hearing of a hot spot in Bemidji? We just mentioned the 9 cases reported from the rally. And is that something that's concerning, that patients need to be transferred to other hospitals that have more space?
Commissioner, might you be on mute?
I sure was. Thank you, Kris, for your reminder. When the phone screen goes dark, I lose track of if I'm on or off. Sorry about that. I was just saying I would ask Kris to comment on any regional outbreak data, but just the larger point of, is it a surprise if a specific hospital or a specific region gets tight and needs assistance? No, it's not. I think that's just a fact and a feature of the fact that our health systems generally run pretty lean, if you will. They don't tend to have a lot of excess capacity at any given time. And it's a strength of our system that the health systems are working together to facilitate that transfer when needed. Certainly we understand from a family perspective, we hope to keep patients as close to home as possible, but I think everyone would agree that getting folks to the right level of care is the priority. And so when we say capacity is within the expected range, we're really looking at the whole system as a whole.
And I'll just add that you asked specifically about the Northwest region.
Yeah.
Yeah, and so for the ICU capacity in that region as of Wednesday, it was the Northwest Healthcare Coalition, which includes Bemidji and Beltrami County, was at 53% full overall. And then in comparison, the metro region was at 95% full and the central region was at 82% full. And certainly if you are interested in any particular facility, it's best to confirm with that facility. But as the commissioner has indicated, hospital capacity statewide is very full. And when a hospital does exceed capacity, then the State Emergency Operations Center works with healthcare coalitions, and they have a process for hospitals to find available ICU beds. I think even as we're focusing on this, increased use of hospitals, it's just another reminder to say the important, but I'm sure wearying message of making sure you follow those 3 pillars of physical distancing, masking, and avoiding large crowds.
When you give these percentages of how full these regional hospitals are, is that with COVID cases or just in general?
That's in general. And as I mentioned a little bit earlier, if you look at the website that includes capacity, and you can go to the Department of Health's website to be able to find the link. That's an easy way to do so. If you look at that website, you'll see it does break down the proportion of beds that are in use by patients with COVID. And you'll see that while that's an important number to us and we're concerned because of what it represents for the severity of illness with COVID, it is a small proportion of the total patients who are hospitalized.
Gotcha. Thank you so much.
For our next question, we have Sarah Coulter from St. Cloud Times. Sarah, your line's open.
Hi, thank you so much for taking my question. What I'm hearing from the call is, the mention of the high levels of community spread and concerns about the caution threshold for test positivity. We're seeing high numbers of daily cases, and then I'm seeing yesterday, and correct me if I'm wrong on this, the MDH updated guidelines for restaurant to increase the size of parties that can be seated in restaurant dining rooms. And to me, those messages seem maybe a little bit in conflict, so I'm hoping you can help me better understand that recommendation.
Well, I think it's a good example of the kind of the complex balance that policymakers are struggling with. I think what happened with the seating guidance was it's an attempt to give a little more flexibility to restaurants. It does not increase restaurant capacity guidance overall. It just allows for seating configurations to be more flexible for the restaurants. And I just take this opportunity to just make the point, as we've said before, if we were looking only at the public health view, we would probably be going the other direction just because of our concern about numbers. But the economic impact, the jobs impact are also really important for the state as a whole and for health in the bigger picture and over the longer term. So I think these decisions are always looked at through multiple lenses, and so I hope that helps. But if you have a follow-up question, I'm happy to try to give you a more specific answer.
No, that was very helpful. Thank you very much.
Okay.
Operator, we have time for one more question.
Yes, we do have. And for our last question, it's from Jeremy Olson from the Star Tribune. Jeremy, your line's open.
Hi. There's been some note of how Minnesota has been kind of an island right now. I mean, it has a high infection rate, but the rates in the Dakotas, in Iowa, and Wisconsin, they're really high. And that's illogical. You said many times that the virus doesn't stop at the border, which is obviously true. But I'm just wondering if you have any thoughts on why that is. I mean, are we just biding our time till we end up like our neighbors, or is there something we're doing that is, at least for now, maintaining a lower rate than those neighboring states?
Well, we'd love to think it's because we just have a higher degree of community agreement on the importance of adhering to the health guidance, and I think Minnesotans in general have done a good job of taking these health risks seriously and of practicing preventive measures. Certainly, there's been attention on the health guidance, the governor's executive orders. I mean, the fact that we have those in place, whereas they have been lifted sometimes by the court, sometimes just by different policy choices in the legislative and executive branches. So we have still more of a prevention framework, I think, in Minnesota than might be true in some of our neighboring states. But I think we do look at those growth rates in the neighboring states just as a cautionary tale and a reminder of how quickly things can change, which I think is why Kris made the point earlier on that we just want to be paying close attention to warning signs, and for us that kind of inexorable case growth and the fact that test positivity is so high in some regions of the state and stubbornly stuck at a fairly concerning level for us statewide are just two of the things that we're particularly wanting to just help people understand that there is a great deal of virus circulating around in Minnesota, and that these preventive measures that each of us can take and we all need to take collectively in order to keep things under control is just something you will continue to hear us emphasizing.
If I could add on to that, Jeremy, if I could add on
Please.
to that, I'd just say that over the course of the pandemic, I think we have had the opportunity to comment on Minnesota versus Wisconsin at least 3 or 4 times. And there have been times when we were in a position to be looking a little bit better, and then there were other times where we were in a position where we weren't looking as good. And so I think it just goes to show that the pandemic is certainly unpredictable. And so I think that, we're grateful for every day that we're not, in a absolutely hideous place. But I think it's important, as the commissioner said, we're looking at what's happening in our neighboring states really seriously, because we recognize that things change, and that, being where we are right now, which isn't great, but we haven't completely fallen off the cliff, that could change very quickly. So I think people need to recognize that this is a very fluid situation, and that although, as I always say, we're grateful for every day with a lower case number or a lower death count, it's not a permanent place to sit. And so we could very well end up like our neighbors if we're not careful and if we're not attending to the things that the commissioner mentioned.
Thank you.
That is all the time we have for this afternoon. If you have any additional questions, please feel free to reach out to our communications office this afternoon. Have a good day, and we will be back with you again on Monday.
Ladies and gentlemen, this concludes today's conference call. Thank you all for participating. You may now disconnect. 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 You may now disconnect.